Hello, today I'm going to be doing a simple interrupted suture on my suture practice thing here. I already did one, but anyways, so prior to starting any sutures, I would first explain to the patient what procedure is going to happen. I would also examine whether the wound could be sutured or if it needs different intervention. But assuming that the patient can be sutured in the clinic or in the emergency room, I would obtain consent. If the patient is less than 18, I would speak to the parent as well, let them know how the procedure is going to happen, or what's going to happen during the procedure. For example, I would let them know that I would be injecting a lidocaine type solution as a local anesthetic and nerve block to ensure that they are comfortable during the procedure. And then I will be stitching using sterile technique. And so the first thing I would do is obviously get consent, have them sign consent, and then prep all my materials. Much of the materials that I would be needing, I don't have on hand right now, but I would need a large syringe filled with normal saline to irrigate the wound, some gauze, sterile gauze, to wipe the area in the event that there's like bleeding, or when I irrigate, I can wipe away debris or anything. And then secondly, I would be sterile. I would have a sterile drape, and I would also have gloves, and most often I would wear a mask. So I would initially prep the skin, maybe with just alcohol at first, so I can inject the anesthetic, the lidocaine solution, into certain areas to do the nerve block. Secondly, while that is drying, I will get my sterile drape, which is, I'm going to use this white paper, and place my tools, which would be also sterile or not. The forceps with the teeth, and they lock. I have scissors also to cut the sutures. I also have, I think they call them forceps with the teeth, to lift the skin while you're suturing. So I have these, and also I have the suture with the needle already attached. So then I would then clean the skin. Most of our hospitals use CHG cleansing wipe, and then the sterile. So it's like a squeeze type mechanism. You shake it and then a sponge and clean it. So I would do that, lay the sterile drape over, uncovering the area that I need to suture. So today I'm going to be suturing this line right here. I already did one so that you could see. All the stitchings, or all the knots, should be on the side. My knot may be on this side because I was suturing it the other way, but as I was preparing, this is what I did. So I'm going to get the suture needle out. So it's this one. It's a little hook this way. So I would have gloves on. So I'm going to hold the forceps, my thumb in one and the ring finger, so I can have easy grip on locking and unlocking. So I'm going to put this in my right hand, so this way, and then I have the forceps here. So I'm going to lift the skin up. Not sure you can see. I'm going to go down a 90-degree angle. Depending on the wound, I would probably go into the dermis. Not too deep, just depending on how deep the wound is. Sorry. This practice kit is actually tougher, the skin. So you go up and then pull through the middle of the wound. This is actually really long. So you leave like about a 1 to 2 centimeter tail, and then take this and go back into the other side. And this is to just ensure that you go at the same depth and angle you did, and same depth as you did when you first entered on the other side. So 90-degree angle, and then you just pull through. It's harder on this one, sorry. There you go, just pull it through. This way. And then according to the video, they said if the thread is too long, you can use your fingers. So because I have better control, I sometimes use the fingers. Then to tie the knot, you wrap it twice. And the string is, or the suture is super long, and then you just pull it through. And then make sure the knot or the tie is on the side. So like that. So like, for example, like this string is super long, so you tie it this way, and then you take it again with your forceps or your finger, as long as it's sterile. See if I can get it. And then you wrap it twice, and then pull it through again. One more time. I don't know if you can really see. Okay. Then you hold it, and then you can cut it so that it is even. Just like that. So I'm gonna just show you what the stitch looks like. So this is the stitch. I don't think you can see. Sorry. This is what the stitch will look like. Right there. So notice that this is not a stitch. That's my practice stitch. But the stitches are all on this side and not in the middle on top, which is what they wanted. So I'm going to keep going. Let me see. Sorry. So grabbing the needle and making sure that the forceps and the is perpendicular to the needle, so that you have a little bit better control. So you want to hold it more like this and closer to the middle, so that you have control of the needle to turn your hand into the suture. So then you just do the same thing. You lift the skin, 90-degree angle, go in. My thing has a lot of holes from all the practice, sorry. So you pull up through the middle of the wound. Don't go straight into the other side. So we pull till there's a tail about 1 to 2 centimeters, and then you again hold perpendicular to the needle, And then you can always click it so you have better control with the forceps. Then you just use, with the, yes, the forceps. And then just lift the skin, go in, same depth, and about around the same as where you had your last stitch. You just go up, release it so that you have more control, and pull it through, just like that. And then wrap twice, wrap twice, and then pull through. And make sure that the knot is on the side. Then you just do the same thing. You wrap twice and then pull this through and tie a knot. You don't want to over tighten it. You just want to be able to approximate the wound. The edges, not approximate. Make sure that they're touching so that they would heal better. So during this time, I would probably be talking to the patient about post-procedure aftercare. I would let them know that they can shower in the next 24 hours. Try to keep the suture site clean and dry for the next 24 hours to prevent any infection in that area. And after 24 hours, they could use soap and water. However, not to use any topical ointment or creams because that may, I'm going to put some Dermabond on here. I'm saying this is like maybe a pediatric patient where you can put a little bit of glue. So you want to just keep the area clean and dry for the first. Oops. So if you're not happy with the stitch, you could always cut it out. And it's better to just be honest rather than try to pretend that it's okay and then let the parents worry or your patient worry about you not being correct at what you're doing. Just let them know, like, oh, I'm not really happy with this stitch. I just want to make sure that I'm doing it correctly. So you could always cut it out and then start over. They have the nerve block, so it should be okay. But just check in with your patient from time to time. Ask them, are you doing okay? Is everything okay? Do you feel any pain? Obviously, little kids get more traumatized because they see you going into their skin. But then just talk to them so it makes them feel a little bit more comfortable rather than them not hearing anything and just seeing their skin get tied together. There's that. Just wrap. In all the videos and even people that I've watched that stitch, they usually do 2 to 3 knots per stitch, just so it doesn't come apart. So there you go. You can just cut it. And then when you're done, you can cut the ends or the tails so that they're more even. This is just while you're stitching. So just remember to go at a 90-degree angle down and in at the depth that you want. Pull it up. Pull it up through the middle. This practice skin is very thick, so it's hard to. Okay, there you go. And then pull it up through the middle of the wound. Okay. Leave the tail and then come back on the other side so you're able to measure the same depth that you did on that side. Make sure that you go in at a 90-degree angle. Okay. Doesn't want to go in. Up. There we go. Just pull the tail out. Then cut it, then I'll do maybe one more. Show it. All right, one more, and I'll show you. So like I said, for pediatric patients, they said that you could put a little bit of Dermabond on top just so that the patients don't, or the kids don't try to pull the stitches, try to pull at the stitches, which I think is also a good idea. It kind of just reminds them not to mess with it. All right, so I'm gonna cut this one. And then I'm gonna go back, still wearing gloves and still sterile, and cut the sutures little bit shorter so they're not so long, and then try to lay them flat. And then place some Durable Bond over it. You could also put dry sterile gauze on top with a little bit of tape just to protect it. But like I said, they could always shower after. Trying to keep it dry while it's healing at least. Okay. So now that I'm done, this is it. These are the stitches, and this one was a little bit off, but as you can see, there should be evenly spaced and enough to close the wound so that it's the edges are closed. So there you go, that's it. And like I said, I would have spoke to them about post-care procedure after the or not after, during the procedure, and then also I would give them a handout explaining what they can and can't do, because sometimes even after the procedure they're not thinking because they're worried about their hand, or they're completely grossed out by the suturing. So I would also give them a handout with patient education and teaching. Thank you.